Welcome to day 5 of our anterior tooth dental anatomy marathon. So far, we've looked at all the incisors: the maxillary central, maxillary lateral, mandibular central, and mandibular lateral incisor. We're going to start looking at the canines now. In this video, the maxillary canine. Hi, I'm Dr. Claire. I'm a practicing dentist and your new dental study coach. I'm taking mountains of textbooks and information and turning them into short, easily digestible videos to make studying in dental school a little bit easier. Be sure to steal my 5-step tooth identification cheat sheet in the description below, where I'm going to work you through a 5-step strategy for identifying teeth on your exams. There are 2 maxillary canines, the right and the left, and those are numbered 6 and 11 using the universal numbering system. We're moving on to another class of teeth, the canines. Canines, unlike incisors, have cusps instead of incisal ridges. There are 4 canines in total, making them the cornerstones of the mouth. The maxillary canine is the 3rd tooth from the midline in the maxillary arch, distal to the maxillary lateral incisor. Canines are often called cuspids because they have that single cusp to them. You might also hear patients call them their fang teeth or vampire teeth. The maxillary canine is the longest tooth in the mouth from the cusp tip to the apex of the root. And the maxillary canine is the most stable tooth in the mouth. The function of the maxillary canine is to cut, pierce, and tear food, support the lips, support the muscles of the face, help with aesthetics, and to protect the posterior teeth through canine guidance. The maxillary canine erupts at ages 11 to 12 years old, and the root completes 3 years later at 13 to 15 years old. The initial sign of calcification is at 4 to 5 months. Let's look at the maxillary canine from the facial. Like the other anterior teeth, the shape of the crown from the facial could be considered a trapezoid, with the larger base towards the incisal and the smaller base towards the cervix. So the tooth is tapering from the incisal to the cervix. However, the canine has a cusp with cusp slopes. So you could also consider the shape of the facial of the crown to be a pentagon. So once again, the canine has a cusp, not an incisal ridge. That cusp tip is going to be centered over the root, and there's going to be a cusp slope to the mesial and to the distal. The distal cusp slope is larger than the mesial cusp slope. Both of these cusp slopes, which you could also call cusp ridges, can have notches to them. Those notches are going to divide those 3 facial developmental lobes. The mesial outline of the maxillary canine is convex over the contact area. Towards the cervical, it could be convex, straight, or even have a slight concavity to it. The mesial height of contour, or contact point, is at the junction of the incisal and middle 1/3. The distal outline has an S shape to it. There's a very prominent bulge or convexity at the contact area. Cervical to the contact area, closer to the cervix, is going to be concave, giving it that S shape. The contact area, or the height of contour of the distal of the maxillary canine, is at the middle 1/3, more cervical than the mesial contact. The facial surface of the maxillary canine is not as flat as the incisors were. There's going to be a labial ridge running from the cusp tip to the cervical line. This labial ridge comes from the middle facial developmental lobe, the most developed of all of the lobes for the maxillary canine, and it includes that cusp tip. To either side of the labial ridge are developmental depressions that divide the 3 facial developmental lobes. The root of this tooth is the longest root in the mouth, and it can curve distally at the apical 1/3, but it could also have a variation where it's going to curve mesially.
Attention dental students. Watch out for buzzwords like longest. Which tooth has the longest root? The maxillary canine.
Now let's flip this tooth over and look at the lingual. From the lingual, the outline of the crown of the maxillary canine is the same as it was from the facial, just seems reversed. The lingual surface is quite irregular. Like the other anterior teeth, or incisors, there is a mesial marginal ridge along the mesial and a distal marginal ridge along the distal. The maxillary canine has a third ridge on the lingual surface, and it's the lingual ridge. This lingual ridge is going to be located between the mesial marginal ridge and distal marginal ridge. It's going to run from the cusp tip to the cingulum. To either side of the lingual ridge is a fossa. To the mesial, there's going to be a mesial lingual fossa, and to the distal, there's going to be a distal lingual fossa. Like all anterior teeth, the maxillary canine has a cingulum. The cingulum of the maxillary canine is centered, very prominent, can be almost cusp-like, and is the most prominent and developed of all the anterior teeth. The crown and root of the maxillary canine are going to taper lingually, so the mesial distal dimensions of the facial are wider than the mesial distal dimensions of the lingual. Now let's look at the mesial and distal of this tooth. Here is the maxillary canine from the proximal view. This is the mesial, this is the distal. The shape of the crown from this view is triangular or wedge-shaped, with the base at the cervix and the point at the cusp tip. The facial outline is convex, but it tends to get straighter towards the cusp tip. The height of contour is in the cervical 1/3, and that cervical prominence is greater than any other anterior tooth. The lingual outline is S-shaped, convex over the cingulum and concave up to the cusp tip. The height of contour is at the cervical 1/3, the cingulum, and the cingulum is more developed and more prominent than any other anterior tooth. The maxillary canine has more bulk, facial to lingual, than all the other anterior teeth, so that the measurement from the facial height of contour to the lingual height of contour is thicker than all the other anterior teeth.
Attention dental students. For great test questions, watch out for words like most and greatest. Which of the following statements about the maxillary canine compared to the other anterior teeth is false? Let's go through these options together. The maxillary canine has the longest root. That's true. The maxillary canine has the longest root in the mouth, the longest root of the maxillary teeth, and the longest root of all the anterior teeth. That's not the correct answer. The maxillary canine has the most prominent cingulum. That is also a true statement. The maxillary canine has the greatest facial cervical prominence compared to the other anterior teeth. Yep, that is also true, so not the correct answer. The maxillary canine has the most symmetrical crown. That is incorrect. The mandibular central incisor has the most symmetrical crown. So the correct answer is D. Remember, the maxillary canine has the most prominent cingulum of all the anterior teeth, the greatest cervical prominence on the facial compared to all the anterior teeth, and the greatest facial lingual dimension of all the anterior teeth because of that prominent cingulum and that cervical prominence on the facial.
The cervical line, or CEJ, where the crown of the tooth and the root of the tooth meet, have a curve towards the incisal. The mesial curve is greater than the distal curve. The cusp tip is labial, or facial, to the mid-root axis line. When you look at the distal surface of the crown, you can see a concavity cervical to the contact area. The surface of the mesial might not have a concavity, or if it does, it's much shallower than the distal. The root of the tooth from this view is conical. It's thicker facial lingually than mesial distally. This helps resist rotation and anchors the tooth very securely into the bone. There are shallow developmental depressions on the mesial and distal, with the distal being more pronounced. Now let's look at this tooth from the incisal. The outline of the maxillary canine from the incisal is diamond-shaped with 4 corners. Those 4 corners are the cervical prominence of the labial or facial ridge towards the facial, the prominent distal bulge towards the distal, the cingulum towards the lingual, which is centered on the tooth, and the mesial convexity towards the mesial. The mesial marginal ridge and distal marginal ridge taper towards the cingulum from the contacts. The maxillary canine is much wider facial lingually compared to mesial distally, and it's the widest facial lingually of any anterior tooth. Looking at the tooth from the incisal, you can see that there is more bulk to the distal half of the crown compared to the mesial half. And that corresponds with that distal bulge. And from this view, it almost looks like a pinching or a stretching from the tooth to the distal contact. The cusp tip is labial to the center of the crown and mesial to the center of the crown. Now the cusp tip is centered with the root of the tooth, even though it's to the mesial of the crown because of that bulk to the distal. The maxillary canine has one very long root, and that root has one canal. If you take a cross section of the maxillary canine's root, you will see that it is longer facial lingually than it is mesial distally. You'll also see that there are depressions on the mesial and distal of that cross section. So we've been talking about the typical features of a typical maxillary canine, but there is going to be variation between canines. A common variation that you should know is having a cusp-like tubercle on the cingulum. And that's it for the maxillary canine. Be sure to give this video a like if you found it helpful, and then be sure to subscribe so that you don't miss tomorrow's video on the mandibular canine. Till then, happy studying. Bye.